We good? Good morning, everyone. I'm Wayne Strasburg, the Wicomico County Director of Administration, and I'm here this morning representing County Executive Bob Culver. With me this morning is David Shipley, our Director of Emergency Management Services, Lori Brewster, our State Health Officer, Sheriff Lewis, Julia Glanz, Mayor Day's City Administrator, and Chief Barbara Duncan. We've called this press conference to advise Wicomico County citizens that we have our first confirmed case of COVID-19. Further, Governor Hogan has issued an executive order limiting public gatherings to no more than 10 people. We will be posting that executive order and several others that were announced this morning as well. We have also learned that there are confirmed cases of COVID-19 in Delaware and also Accomack County, Virginia. So this virus has now arrived on Delmarva, and we anticipate that the spread of the virus is going to grow now that it's here. At this point in time, I'm going to turn the mic over to Lori Brewster so that she can provide you further details on the virus itself and appropriate precautionary measures that you can take to protect yourselves.
Thank you, Wayne. We were notified this morning that we had an individual, male in his 30s with recent travel outside of the country who has tested positive. The individual was tested not in the county, not at PRMC. The individual is doing well, is quarantined at home. We have been in contact with the Maryland Department of Health. We will be ensuring that the individual remains on quarantine in his home. We are reaching out to any individuals that may have come in contact with the known positive case. We are also continuing to work with Peninsula Regional Medical Center for planning on future possible cases that arrive in Wicomico County. So we will be keeping the public informed with local, state, and federal updates, both on our website and through social media. We are continuing, as I said, to work with the hospital to potentially screen individuals in the future. I cannot encourage you enough to maintain social distancing and practice proper hand washing and other common precautions such as cleaning and disinfecting touch surfaces. Also, if individuals have any symptoms, it is extremely important for them to self-quarantine, contact their provider, and if they need to be seen, their provider will let them know. So where can you get information on COVID-19? We have our call center that has been open for over a week now. You can call that number, which is 410-341-4600. You can go to the wicomicohealth.org website, the Maryland Department of Health's website, which is health.maryland.gov, or the Center for Disease Control website, which is cdc.gov. Now I'd like to turn it over to David Shipley for some comments.
Thank you, Lori. The Department of Emergency Services has activated the Emergency Operations Center for Wicomico County. This has been done to support the efforts and coordinate the efforts in support of the health department. In that respect, we are participating on a daily basis in 2 conference calls. One is with the Maryland Emergency Management Agency, so we can keep abreast of a situational awareness of all that is occurring in the state of Maryland concerning emergency management operations. And we are also conducting a local call on a daily basis that involves our fire and EMS personnel, our local municipalities, and law enforcement and county administration. Again, to keep aware, and Lori Brewster is doing a briefing at that local call, and it's for purposes, again, of keeping abreast of situational awareness in the county.
I would like to say that things have changed. As of yesterday, I received many calls, and I know my colleague, Chief Barbara Duncan, did, regarding the assemblies of 50 more individuals here in Wicomico County. That has changed effective 5 p.m. today. The governor, as part of his declaration of emergency, no more than 10 individuals can assemble at any given time at any given location. So that's very important to remember that. And we have now been given clear, definitive language from the governor's office, from our state's attorney's office, on how we are to charge individuals who are in violation of the law. And that would include businesses and facilities throughout Wicomico County. As first responders, fire personnel, EMS, our paramedics, and law enforcement in Wicomico County, we will be requesting a list of any individuals who are believed to be infected with COVID-19, so we can respond accordingly if we get called to that particular home while these individuals are in a quarantine. Chief? Ms. Glanz?
Good afternoon. I'm Julia Glanz, the City Administrator for the City of Salisbury. The Mayor has literally walked in the door on his way back from Army National Guard duty. He was called up for the day, but is back. It's unfortunate that we're here today, but we have been planning for this day and expecting this first case for some time. The City of Salisbury is working in partnership with the County Health Department, with PRMC, the county government, and regional partners to best address this pandemic. And I'm sure many of you will feel that this is more real now that it is in our community officially, but I urge you to please continue good judgment while out in public. There is no need to rush to the grocery store to buy up all of one product. We will continue to get shipments of foods and supplies. Many grocery stores are holding senior citizen only hours for shopping. If you are not a senior citizen, please respect that policy and go at a different time. Most of our local restaurants have shifted to delivery and pickup. Please continue to support them in a safe and healthy manner. And ultimately, if your job enables you to stay at home and work from home, please do your part to do that. Our emergency responders are continuing to serve the public. They are in full personal protective gear. Please, if your symptoms are minor, stay home and call your doctor and 211. The Salisbury Fire Department will continue to support our community in this challenging time. The Salisbury Police Department, as of yesterday, has moved to taking reports for certain crimes over the telephone to help slow the spread of the virus. For example, these types of crimes that will be reported over the phone include fraud, larceny, malicious destruction of property. But to report a crime or to get more information, please call 833-SBY-CITY. And finally, this community continues to amaze me and all of us up here by the support of each other. To support those community efforts, continuing efforts, the governor announced the Maryland Unites website this morning. This website is to support those who want to volunteer and look after our neighbors. So please visit that website to see how you can get involved and look after your neighbors. And finally, the City of Salisbury has stood up a website in reference to this epidemic. It is salisbury.md/CRTF, and we'll be putting that out on social media for the most pressing updates. So.
Well, good afternoon. I will be fairly brief, as I'm certain that our sheriff, our health officer, our police chief, our fire chief, our county director of administration, emergency services director, and our city administrator have been comprehensive in their remarks. I want to share that while I was traveling on the other side of the bridge and fulfilling other obligations related to our state of emergency service statewide. I was watching the governor's press conference, so I was able to hear the governor's remarks, the adjutant general's remarks, obviously standing there with our transportation secretary and other state leaders, including the colonel of the Maryland State Police. The statewide effort continues. I continue to be impressed by the leadership provided there. And speaking locally, I do recognize that we're entering what could be described as a new phase here. But I want to remind everyone that the steps being taken are in anticipation, or were in anticipation of this moment. There is no doubt in my mind that Health Officer Brewster has anticipated from day one that this virus would arrive here. that our County Emergency Services Department and the entire team at the county and the city have anticipated that. This morning, our Field Operations Department was assisting Peninsula Regional Medical Center in establishing a second hospital facility, an inflatable mobile, or excuse me, not mobile, but an inflatable and temporary building that is now has hardened perimeter and is set up in anticipation of the surge that we may see. I do want to again say, recognizing that the first case of COVID-19 of the coronavirus has arrived here, I understand that people will be concerned. And they should be. We've tried to impress upon people the level of concern you should have, and thus the level of precautions you should take. Clearly, with the governor's decision to further restrict commerce and to further restrict the potential for community transmission, there's no doubt that everyone is trying to protect public health. In anticipation of the consequences, the economic consequences for both individuals and businesses, the gathering that was held last Tuesday, or Tuesday this week, of the Emergency Business Roundtable, what we're now looking at or calling the Corona Recovery Task Force, we're looking at how we can help those businesses. And I do think the leadership that Governor Hogan showed in establishing the Maryland Unites initiative to highlight not only the good work that people are doing, but volunteer opportunities and initiatives taking place in communities throughout the state of Maryland is exactly what we should be emulating and replicating. And it will determine whether or not we are successful in getting through this and in being resilient. And I want to highlight just one note that came out of our conversation on Tuesday, and it's this. A story was shared about a business in town, Delmarva Veteran Builders, and a mantra that they use, be the buffalo. And they explained to us that the buffalo runs headlong into the storm, recognizing that that's the shortest and fastest way through it. And that's the mantra that I think each of us is taking into this. We're going to drive headlong at this thing. We're going to be better for it, and we're going to be stronger for it on the other side of it. I will reiterate that actually at the direction and with the support of County Director of Administration Wayne Strasburg, and I hope you don't mind me saying that, we have established a regional website which will be populated. It's a place you can go to trust that you're getting the latest from the county, the latest from the city, the latest from our neighboring counties, coronarecoverytaskforce.com. That website will continue to be populated by government officials, government sources on things that you can do, and on the status of government services, as well as the status of the emergency orders and executive orders that are in place that restrict freedom of movement, that restrict commerce, and restrict assembly. So with that, I will step aside, hand it over to another one of my colleagues. I don't know who's next, but I just want to say again, you've got a team here that is working day and night to ensure the safety and integrity of our public health and what exists of not only our public health system that's there every day, but on top of that, our emergency public health system. So you got a lot of people working very hard that you can trust and count on for your public safety. I have absolute confidence in every single one of them, and you should too.
Just to wrap up, I wanted to remind everybody that if you have questions or concerns, you can certainly contact the Wicomico County Health Department's call center at 410-341-4600. Thank you.
Thanks, everybody. Absolutely. Appreciate your time.
Questions? Are there any?
Any questions? Yes, sir.
Yes, with Governor Hogan announcing that there was a 5-year-old that tested positive for COVID-19, what are the precautions that you could suggest to people that are concerned not only about contracting the disease, but at the same time too, that are concerned about their kids now, seeing that this is the first confirmed case for a child so young?
I'm going to let our health officer respond to that, but what I would say right out of the gate is that the notion that younger people are somehow immune to this virus has been disproved. And I think that the same social precautions that adults are taking need to extend to our young folks as well. But I'll let Lori address that further.
So with our children and our younger individuals, we know that the first thing that goes in their mouth is their hands. And we need to make sure that we wash their hands frequently, that we clean the touch surfaces frequently with Clorox wipes or some type of bleach substance so that those surfaces are clean. And if you are sick or they are sick, keep them home. Do not send them to a daycare or a public setting. And if you need additional assistance, you can certainly reach out to the health department call center.
Any further questions?
What other measures is the department taking, not just because of these spikes in cases, but to kind of like bring people to ease? Because a lot of people are very alarmed right now.
Again, I think I will let the health officer address that since this is a health crisis.
Since before the first confirmed case in Maryland, we have been getting information out on social media about things that individuals can do to prevent themselves from getting in contact or getting ill with the virus. And I think that people need to understand that if they are ill, they need to stay home. I know I keep repeating that, but that is the single most important measure. And if you are ill and you feel like you need to seek treatment, then call your provider. Don't just show up in the emergency department or show up at a provider's office. We know that this is scary. We know that individuals are concerned, but we need to take this one step at a time and not panic. As we have seen some individuals in other parts of the country do that, and we don't need to be going and buying up all types of food and leaving nothing in the grocery stores. Most of the individuals that have come in contact with this have recovered. We did have a death in Maryland for today. But that was an individual that had co-occurring chronic conditions. So if you are a generally healthy individual, you will get well eventually.
With that, if there are no other questions, I'll just reiterate what Lori said earlier and what Ms. Glenn said earlier. We know that this is serious. We don't feel that there's any need to panic. There really is no need to panic, but it's appropriate to be prudent and to take the necessary precautions and to take the guidance that's coming from health officials very, very seriously. Thank you.